to the show, Meg and Rachel.
Thanks.
How are you both? All good?
Yeah, I'm absolutely fine, thank you. How are you, Sue?
Good, very good. I hear you have new jobs.
So obviously I was the project lead on the Dying to Talk, and Meg, chip in wherever you can.
Yeah, so I was the best practice administrator.
And then at the beginning of the year, MacIntyre had a job opening within the health team. So the health team is a group of ladies, actually, where there's myself, there's Meg, there's Nicola Payne, who's our manager, and then there's Rachel and Rosie, who are experts by experience. So Rachel and Rosie work within the group, and we help MacIntyre cover all different types of health issues. So things we're currently working on, all sorts of different projects, but any sort of health issue that anybody has, if we don't know, we will find some information out for you and get training for people.
Yeah.
Awareness training. So we cover anything to do with health. So things like cancer. We cover eating, drinking, diet, weight loss. Just anything you can think of, we will cover. And if we don't cover it, maybe we haven't thought about it and need to be covering it.
Okay, Meg, what
Yes.
do you do as a team?
What do we do? Well,
Yeah.
I guess it'd be what do we not do? We do anything and everything that you could think of. And so that is in terms of we offer training and support to the people who draw on our support at MacIntyre. We offer the same as well to staff teams. And yeah, it's difficult to pinpoint exactly because we do a mixture of all sorts of things.
Right. Okay, thanks, Meg. Right, Rachel, what services do you offer?
So currently we can offer Zoom services. So anything to do with health and wellbeing, we can offer via Zoom or Teams. So we can do online presence. We can also do service visits. So if you don't like internet very much or you don't like technology, we can come out and visit you at your own home. But I've got an online book club starting in October. So a health related book club along with Books Beyond Words. So they are picture books that we are going to enter the whole health book club around things like diabetes, looking after yourself down below. We help create Easy Read along with the Checkers and Anita Taylor, who is our Easy Read creator. We source information from outside agencies, so we work very closely with Willand Hospice and other local hospices. We work closely with the NHS.
An important thing to remember as well is that we work alongside other specialists within the best practice team. So we've always got, yes, we're specific on health, but we always think about person-centered approaches. We think about PBS, we think about communication. And we also work very closely alongside compliance, making sure that everything that we do is working on a compliance level. So it's a massive, it's co-production really at its finest, isn't it?
When did the health team start, Meg?
Myself and Rachel being on the health team, officially we've worked as a 5 since March, beginning of March.
Wow, that's quite long, isn't it?
So as Rachel said, that's myself, Rachel, Nicola Payne, Rachel Silver and Rosie Joustra.
Yeah, that's right. Oh, thanks, Meg. We've been working on something together, haven't we, with the group?
Yeah, we have. Again, with the health team, we look at specific projects. So alongside the Dying to Talk project, there was a little off research project called the Victoria and Stuart project, which is what myself and you work on, Sue.
Yeah, and so a few other people in the group.
There's a few other people, and that's another focus on on the sensitive subject of death and dying, isn't it? And advanced care planning. And so we've been working together since January. I know.
So it's gone quick.
Working hard towards a toolkit that we're going to trial in MacIntyre.
Toolkit. Yeah.
So hopefully we'll be doing a lot more in a lot more areas around September, October time.
It's probably worth mentioning the Oliver McGowan co-trainer project.
All right.
So I don't know if you know about Oliver McGowan.
No, I haven't heard of it. No.
So Oliver McGowan was a young gentleman, a young boy who passed away in hospital. Due to health inequalities, people not really listening to him, not listening to his family. And his mum has campaigned, so she's gone to Parliament, she's really fought his case for people within the health and social care sector to have training on learning disabilities and autism. And MacIntyre are one of the groups of people that have been trained to provide this course to other people. So we're going to everybody involved within MacIntyre will be having this training on learning disabilities and autism.
Right.
And the training itself is co-produced, so people who have got a learning disability or autism will be doing the training with a trainer. So I'm one of the trainers, Meg's one of the trainers. There is a small group of trainers that we will be working alongside people with a learning disability and autism to provide the Oliver McGowan training to all the staff within MacIntyre.
Okay, brilliant. Rachel, what are you working on in the next few months?
Wow. Well, if you ever see our workload, we've got something that's called buckets. And if you ever heard buckets being mentioned around the health team, we've got about, is there 8 or 9 buckets, Meg?
I want to say 10 now. We've got tons of buckets.
Buckets of what?
Buckets of jobs.
Oh, bucket jobs.
Bucket jobs. So basically, we're working on Teams, which is a digital platform where we have these little groups of things and we put jobs in them. So we've got things like health inequalities. So we've already mentioned that with the Oliver McGowan project or training, but it's things like making sure that people with a learning disability and autism are aware of their choices and their rights when they go and see the GP. They can have people with them. They can ask for the GP to come to their own home. They don't have to go to the GP practice. They can have somebody with them to support them. And also accessibility, so you can have easy read documents, you can have visual conversations rather than just having it written on a bit of paper. So it's things like reasonable adjustments. So we're working very closely with that. We are also working closely on specific health related topics. So one of the topics at the minute, because it's quite big within the health and social care sector, is constipation. So whether people can't go for a poo and so we're working very heavily around constipation. Again, death and dying, you're involved with that with Meg. But Meg, I don't know if you want to mention, because obviously constipation links in with leader really. Yeah,
definitely. So leader is a program that MacIntyre submit lots of data to. So whenever we have a death, sadly, within MacIntyre, we submit, we ask questions about it, and then we submit it to leader. Which is called Learning from the Lives and Deaths of People with a Learning Disability. And looking into that, and it focuses heavily on the health inequalities that we are seeing within health and social care sector. Constipation at pre-COVID, pre-pandemic times was one of the top 5 causes of death.
Okay, how do you link to our DNA?
So the health team lives and breathes the DNA. I think if you cut us open, we'd be purple inside. We want equality. we want everyone to feel safe and in control as well.
We've also added into that, Meg, our manager, Nicola Payne, is also the family engagement officer for MacIntyre. So we link very heavily with families, and I'm currently working with a family member to co-produce a training session around his family, his son and daughter who've got a very rare health condition. And so pulling on his expertise, his knowledge, to make sure that we know we are training and working alongside people. So it's all that co-production side of things as well. So we like to work with people who live and breathe MacIntyre as well. So that is why we love the DNA. The DNA is us. Like Meg said, cut us open, we're purple.
Right, I'd like to thank Rachel and Meg coming on Sue's show.
Thank you for having us.
Thank
Sue.
you.
Thank you.
Meg. Thank you.